The Millennium Development Goals are supposed to be done and achieved by the end of 2015. They're not going to be all achieved, but already there's negotiations about a follow-on agreement. It's emerging in bits and pieces, in drafts. People are talking about it. This global health piece and the partnership piece, how do you see that flowing into that agreement?
Well, I think that it's interesting. I think even since the last Millennium Development Goals were made in 2000, we've seen a dramatic change in the nature of partnership and a dramatic change in who has a seat at the table in making the decision. Also, I would say a dramatic improvements in the understanding of the problems and a more nuanced understanding of what works and what doesn't. So, and I think that the process that's already underway for the post-2015 is a very engaged, inclusive process, much more so, I think, than even the last time we did this. The value of that, of course, is that there's expanded ownership, and that those who have a seat at the table are going to be more likely to have ownership of the problem as it goes forward. So I think just that process of engagement around creating the goals has itself an important foundation for going forward. I would say that we're still about 20 months away from the MDG original targets, particularly what we're interested in, which is maternal and child and HIV, the health targets, the MDGs 4, 5, and 6. And this comes back to that issue that we talked about earlier, which is about delivery systems. And how do you choose which delivery systems to invest in? And if one of the issues is that we're on a short deadline and want to achieve those goals, I think there's values in achieving goals. There's values in building confidence in the community and saying that we did what we said we're going to do and in meeting our obligations to do that. I think that enters into this discussion of what kinds of delivery systems do we use. And if we're interested in delivery in difficult areas that may not have routine systems, but do have alternative delivery systems, we have to ask ourselves, A, technically, are those suitable for the kinds of interventions we're talking about? And if so, should we use them, and what are the implications of using that for other parts of the health system? So some of the issues we deal with in my office are those kinds of issues around if you wish to achieve those goals, what are the kinds of choices around delivery systems that you try to advocate for?
Interesting. Can you give us maybe a further look under the hood right now of those negotiations? We saw the draft that a high-level advisory panel put together roughly a year ago, and health was mentioned in there very prominently, of course. Universal health was something that a lot of health advocates were calling for, universal health coverage, and that was not, I think, explicitly included. Is that one of the biggest sort of points of debate right now, or what do you see as sort of the stumbling blocks or the remaining issues that are being negotiated?
So there are issues that have played out in public health for the last generations in terms of what we call the horizontal services as equity for all versus targeted services, which is a more technical approach for what works. And I think that this reflects itself in this discussion as well. And I think the idea of universal coverage is one which is an equity-based process which says we want everybody to have the same coverage. And if you're a political leader in a country, certainly an equity-based approach is very appealing to do, and maybe your mandate to represent all people in your society, not choose between ones or particular ones. I think if you're a technical person or a finance person, you may have a different mandate and a different understanding of what can and should be done. And I think that those are the kinds of the debates that are playing out now in terms of a technical, quantitative, finance-based approach versus an understanding of human rights and political-based approach.
And how do you see that all shaping up in that final agreement?
I don't know. I mean, I think that we're maturing as a community of people. And I think that we understand that we need to account for a range of interests. I think we understand the advocacy value of being inclusive. I think we understand that narrow technical approaches maybe not the best way of doing this. I think we're also understand that achieving universal anything is very difficult. So I would bet on a mature and nuanced approach coming out.
All right, let's put it in very diplomatic terms. We look forward to seeing what that actually looks like on paper.
Yes.
And thank you very much for being with us.
Thank you.